Hello, thank you very much for your interest in our poster titled Ultralight Wheelchair for Individuals with Stroke, a Preliminary Study. I will be presenting this poster. My name is Sujay Galen, and joining me today is my colleague, Dr. Emily Buchman, giving this presentation. I would also acknowledge our co-authors, Dr. Jordan Nourse and Dr. Amber Weiss and Dr. Catherine A. McLeod. So let's start with the motivation to do the study. There are over 7 million stroke survivors that are currently estimated to be living in the United States. Almost half of these individuals at discharge require mobility using a wheelchair. And oftentimes with stroke comes impairments of using their upper extremity, so their use of a wheelchair is not the most optimal pattern. And 40% of the stroke survivors use manual wheelchair following discharge from the hospital, even when they're back home. And again, they already having all these cardiovascular issues makes it even more difficult for them to use these wheelchairs to go about doing their activities of daily living. So the problem here really is that suboptimal wheelchair propulsion pattern that has been previously reported, but also that's something we clinically observe in individuals with stroke. And so far, when we looked at the literature, there's just one study that's looked at individuals using ultralight wheelchairs. Therefore, there's very limited research on the benefit of an ultralight wheelchair for individuals with stroke. Therefore, the purpose of this investigation is to look at the impact of an ultralight wheelchair design on wheelchair skills and performance in healthy individuals and also individuals with stroke. As far as this poster is concerned, we will be primarily presenting our healthy individual data because our stroke data is being collected as we speak. Now over to Dr. Buchman.
So our hypothesis for this presentation and study was that measures of wheelchair performance, such as the wheelchair skills test and the wheelchair propulsion test, will be significantly different for ultralight wheelchairs compared to a standard wheelchair. And here in this image, you can see the ultralight wheelchair, just an image of that a sample one that we used in the study, and then also the standard wheelchair here on the right-hand side. So the data we'll be reporting is about 4 healthy individuals with a rough age of around 25 years old. And we had them fitted to a wheelchair, each of those wheelchairs, and they were given about 5 minutes or so to get acclimated to the wheelchair. They were able to wheel around freely in the clinic to become accustomed to it before testing. And then they were asked to propel the wheelchair using only their dominant arm. And so they were asked to simulate a hemiparesis for the healthy individuals. And so our outcome measures were the shortened wheelchair skills test. And in that, the maneuvers that we looked at were forward and backward propulsion, maneuvering around objects, turning in place, coming to a halt quickly, and picking up objects. And you can see here in this image, this individual is working on picking up objects from the floor. And we used these little plastic cones as the barriers for some of the maneuvering skills in the lab. And then for the wheelchair propulsion test, we looked at the number of propulsive cycles, the elapsed time that was spent wheeling down a short distance, and then the technique used over that 10 meters. And back to Dr. Galen for the results.
Thank you, Dr. Buchman. So looking at the results, on the table that I'm showing here, we're showing the percentage difference between a standard wheelchair and an ultralight wheelchair. So when the value is negative, that means it took a little greater value in the ultralight wheelchair. So when you see those negative differences for roll forward and roll backward maneuvers, that means the time taken to do that with the standard wheelchair was lesser compared to the ultralight wheelchair. But when we look at maneuverability, for example, how did they do a counterclockwise or clockwise turn? Those were significant for our ultralight wheelchair, because what happened is when somebody tries to turn counterclockwise or clockwise, they got displaced much greater with a standard wheelchair, whereas with the ultralight wheelchair, that displacement was lesser, which means when they're using their wheelchair, let's say in a home environment, for them to turn around, they really need a very small footprint or area to execute that maneuver. And I'm showing the same data graphically to you on the right-hand side of the screen. So the two things that really stood out or were significant in this population was that maneuverability data of turning clockwise or counterclockwise. And then we also looked at in the wheelchair propulsion test, the speed of propulsion, push frequency, and the effectiveness. And once again, with the standard wheelchair, the individuals were able to move slightly faster and hence the positive value. And the push frequency and the effectiveness were not significantly different. Again, we have graphically presented those data to you to show that there's not a lot of difference between the ultralight wheelchair and the standard wheelchair. So with that, the preliminary study that we have completed right now has demonstrated that it is feasible for us to use this testing protocol among individuals with stroke. And like I previously mentioned, we are currently collecting data with individuals with stroke, and we hope to present it in the near future. And the preliminary results show that the maneuverability with an ultralight wheelchair is better compared to a standard wheelchair, and hence moving in very small areas will be much better for our patients, hopefully. So the clinical relevance really from this research is that we hope the data we're collecting both with healthy as well as with our stroke individuals would provide clinical practitioners and also payer sources with data to support the future of wheelchair use, especially when they need to recommend an individual to have an ultralight wheelchair to maximize their functional mobility. Thank you very much for your attention. If you have any questions, please do email us. Our email details are provided on the poster. Thank you.